Hi there, welcome in. I'm so glad you made it here today. Before we get started, I'd love to hear where you're tuning in from and what time it is for you. It's such a treat to see the variety of places and times represented in this community. I also want to gently thank those who have subscribed and clicked like on the videos they enjoy. It really helps this space grow. And of course, if you have ideas for new content, I'd love to hear them in the comments. With that, let's begin. Chapter 1. Understanding Drug Mechanisms in the Body. Imagine a world where tiny molecules hold the power to transform our well-being, guiding our bodies towards healing and relief. This is the intricate realm of drug action, where each compound has a unique story to tell, a path it follows to elicit therapeutic effects. At its core, drug action involves the interaction between these chemical agents and the biological systems they target. A simple molecule can bind to a receptor, triggering a cascade of events that leads to profound changes within our body. It is a delicate dance of chemistry and biology, where precision is essential for the desired outcome. Understanding how these substances work is not merely academic. It is a gateway to unlocking new treatments and improving health outcomes. The significance of studying drug mechanisms lies in the ability to create more effective therapies, minimize side effects, and tailor treatments to individual needs. Each discovery adds a brushstroke to the larger canvas of pharmacology, painting a clearer picture of how we can harness the power of these compounds for better health. Pharmacology, the study of drugs and their effects on the body, introduces us to several key concepts that underpin this fascinating field. One such concept is the idea of receptors. Think of them as specialized locks on the surface of our cells, waiting for the right key, often a drug, to unlock their potential. When a drug binds to its receptor, it can either activate it, initiating a response, or block it, preventing a response from occurring. This simple yet profound mechanism is the cornerstone of many therapeutic interventions. Consider the story of a remarkable scientist, Paul Ehrlich, who pioneered the concept of the magic bullet. He envisioned a substance that could target specific pathogens without harming the host. His work laid the groundwork for the development of antibiotics, transforming the landscape of medicine. Ehrlich's insight reminds us that understanding drug mechanisms can lead to groundbreaking advancements in treatment. Another critical aspect of drug action is the concept of pharmacodynamics, which explores how drugs exert their effects on the body. This involves examining the relationship between drug concentration and the resulting biological effect. Imagine a bell curve, where too little of a drug may yield no effect, while too much may lead to toxicity. Achieving the right balance is key to successful treatment. In addition to pharmacodynamics, we must also consider pharmacokinetics, which describes how the body absorbs, distributes, metabolizes, and excretes drugs. Every medication undergoes a journey within the body, influenced by factors such as age, weight, and genetic makeup. This journey begins the moment a drug is administered, whether through a pill, injection, or other means. The body's response can vary widely, highlighting the importance of understanding these mechanisms to optimize therapeutic outcomes. Imagine holding a glass of water, taking a sip. The water travels down your esophagus, enters your stomach, and then moves into the intestines, where it is absorbed into the bloodstream. Similarly, when a drug is ingested, it undergoes a complex process before reaching its intended target. Factors such as the formulation of the drug, the presence of food, and the health of the gastrointestinal tract can all influence absorption. Once in the bloodstream, the drug is distributed throughout the body, often binding to proteins in the plasma. This binding can affect how much of the drug is available to exert its effects. For instance, if too much of a drug binds to proteins, less will be free to interact with its target. This intricate balance is why dosages are carefully calculated, ensuring that enough of the drug reaches the site of action while minimizing potential side effects. Metabolism, the body's way of processing drugs, is another crucial factor in understanding drug action. The liver, often referred to as the body's chemical factory, plays a central role in this process. Enzymes within the liver modify drugs to prepare them for excretion, often transforming them into more water-soluble forms. This transformation facilitates their removal from the body, ensuring that substances do not accumulate to toxic levels. Excretion, the final step in a drug's journey, usually occurs through the kidneys, but can also happen via bile, sweat, or even exhalation. It is fascinating to think about how our body works tirelessly to maintain balance, removing what it no longer needs while retaining essential nutrients and compounds. As we explore these concepts, we encounter the idea of drug interactions. When multiple drugs are taken, they can influence each other's effectiveness, leading to unintended consequences. This is where understanding mechanisms becomes paramount. For instance, one drug may inhibit the metabolism of another, resulting in increased levels of the second drug and the potential for toxicity. Consider the words of the esteemed pharmacologist, Sir James Black, who famously stated, "Drugs are not just chemicals, they are a bridge to the understanding of the biological processes of life." This perspective emphasizes the importance of comprehending how drugs interact not only with their targets, but also with each other and the intricate biological systems they enter. The study of drug mechanisms is also enriched by the field of pharmacogenomics, which examines how our genetic makeup influences our response to medications. Imagine a world where treatments are tailored to your unique genetic profile, optimizing efficacy while minimizing adverse effects. This is not just a dream. It is the future of personalized medicine, where the nuances of our DNA guide therapeutic decisions. The story of Dr. Francis Collins, who led the Human Genome Project, offers a glimpse into this world. His work has paved the way for understanding how genetic variations can affect drug response, potentially revolutionizing how we approach treatment. As we consider these advancements, it becomes clear that the more we understand drug mechanisms, the closer we come to individualized therapies that resonate with each person's biological makeup. As we delve into the fascinating world of drug mechanisms, we must also acknowledge the ethical considerations that arise. The power to influence health through drugs carries with it a profound responsibility. The decisions made in the lab and clinic can have far-reaching consequences, not only for individuals, but for society as a whole. It is essential to approach this field with a sense of stewardship, ensuring that the benefits of scientific discoveries are shared equitably. In this journey of understanding, we find ourselves at the intersection of science and compassion. Each breakthrough in drug action is not just a technical achievement, it is a promise of hope to those who suffer. The stories of patients who have found relief through innovative therapies remind us of the profound impact that knowledge can have on human lives. As we continue to explore the mechanisms of drugs within the body, let us embrace the wonder of discovery. Each small insight contributes to a larger narrative of healing and health. The field of pharmacology is ever evolving, driven by curiosity and the desire to improve lives. In this pursuit, we are reminded of the beauty of science, a tapestry woven with threads of inquiry, compassion, and the unwavering belief in the possibility of progress. As we further explore the intricate relationships between drugs and the body, we encounter the concept of therapeutic indices. This metric serves as a vital indicator, guiding healthcare practitioners in understanding the safety and efficacy of a drug. The therapeutic index compares the dose that produces a therapeutic effect to the dose that leads to toxicity. Imagine a narrow tightrope where one misstep can lead to adverse effects. A drug with a high therapeutic index offers a wider margin for safety, while one with a low index requires careful monitoring and precise dosing. The journey of a drug does not end with its administration. Once it enters the bloodstream, the body's intricate systems begin to engage in a complex interplay of biochemical reactions. This brings us to the fascinating world of pharmacodynamics, which delves deeper into how drugs affect the body at the molecular level. Picture a lock and key mechanism. A drug, acting as the key, fits snugly into its receptor, triggering a series of biochemical events that culminate in a physiological response. This elegant mechanism is foundational in understanding how drugs can alleviate symptoms or combat diseases. The effects of drugs can be broadly categorized into therapeutic effects and side effects. Therapeutic effects are the desired outcomes that healthcare providers aim to achieve: relief from pain, reduction in inflammation, or the eradication of infection. On the other hand, side effects are the unintended consequences that may accompany treatment. These can range from mild discomfort to severe complications, emphasizing the importance of personalized medicine. Imagine the careful balance clinicians must strike. They must weigh the benefits of a medication against its potential risks. This is where clinical trials play a crucial role, providing a structured environment to assess drug efficacy and safety. The trials, which often span several phases, involve diverse populations to ensure that the findings are generalizable. The story of Dr. Tu Yaoyu, who discovered artemisinin for malaria treatment, exemplifies the importance of rigorous research and the exploration of drug mechanisms. Her journey began with a quest to find a remedy for malaria, a disease that has plagued humanity for centuries. Through her innovative approach of studying ancient Chinese herbal medicine, she isolated artemisinin and demonstrated its effectiveness. This groundbreaking work not only saved countless lives, but also highlights the profound impact that understanding drug mechanisms can have on global health. As we reflect on these concepts, the role of pharmacovigilance emerges as a critical aspect of post-marketing drug safety. Once a drug is approved for use, ongoing monitoring is essential to identify any rare or long-term side effects that may not have been evident during clinical trials. This vigilance ensures that the benefits of a drug continue to outweigh its risks, allowing for timely interventions if adverse reactions occur. Consider the landscape of modern pharmacology, where data analytics and real-world evidence play an increasingly significant role. Imagine the vast amounts of information generated from patient experiences. This treasure trove of data can provide insights that enhance our understanding of drug mechanisms and their effects in diverse populations. Moreover, the integration of technology in pharmacology has opened new avenues for research and development. Artificial intelligence, for instance, is being employed to streamline drug discovery processes, analyze complex data sets, and predict how new compounds might interact within the body. The potential for innovation is boundless, offering the promise of faster, more effective therapies that can meet the evolving needs of patients. As we consider the future of pharmacology, we must also confront the ethical dilemmas inherent in drug development. The balance between scientific advancement and ethical responsibility is delicate. Researchers and healthcare professionals must navigate complex questions about access, equity, and the implications of their discoveries. What does it mean to ensure that groundbreaking therapies are available to all rather than a select few? The narrative of drug mechanisms is not solely about the molecules themselves. It is also about the people they impact. Each story of healing is interwoven with the fabric of science, compassion, and the relentless pursuit of knowledge. The dedication of scientists, clinicians, and patients alike drives the field forward, inspiring new generations to engage in the quest for understanding. In this quest, we are reminded of the words of Sir William Osler, who once said, "The good physician treats the disease, the great physician treats the patient who has the disease." This philosophy underscores the importance of viewing drug action through a holistic lens, one that considers not just the biochemical pathways, but also the human experience intertwined with them. As we delve deeper into the mechanisms of drug action, let us embrace the interconnectedness of science and humanity. The exploration of how drugs work is a journey that holds the potential to illuminate paths toward healing, fostering hope and resilience in the face of illness. Each insight gained serves as a stepping stone toward a future where the power of medicine can be harnessed to promote health and well-being for all. In this ongoing narrative, the stories of discovery, innovation, and compassion continue to unfold. Each chapter invites us to ponder new possibilities, encouraging a sense of wonder as we uncover the remarkable complexities of drug mechanisms and their impact on our lives. Through understanding, we can foster a deeper appreciation for the delicate balance of biology, chemistry, and the human spirit, connecting us all in the shared pursuit of health. Chapter 2: How Drugs Interact with Receptors. In the intricate landscape of our bodies, receptors serve as sentinels, crucial components that reside within the membranes of our cells. These specialized proteins act as gateways, responding to specific signals and orchestrating responses that maintain homeostasis and influence our physiological functions. Each receptor is designed with remarkable specificity, interacting with particular molecules such as hormones, neurotransmitters, or drugs. Imagine them as locks waiting for the right key, where each key represents a different substance, unlocking pathways that lead to various biological effects. Receptor binding is a complex yet elegant process. When a drug enters the body, it may find its way to a receptor, much like a key sliding into a lock. This interaction is not merely a physical connection. It involves a series of intricate molecular interactions. The drug binds to the receptor through various forces, including hydrogen bonds, ionic interactions, and hydrophobic forces. These interactions dictate how strongly a drug will bind and how long it will remain attached. The affinity of a drug for its receptor can significantly influence its therapeutic effects. Higher affinity means the drug can exert its influence at lower concentrations, potentially reducing the likelihood of side effects. The mechanisms of receptor binding can be classified into several types of interactions. Consider agonists, which are drugs that bind to receptors and activate them, mimicking the action of naturally occurring substances. For example, morphine acts as an agonist at opioid receptors, providing pain relief by imitating the body's own pain-relieving chemicals. On the other hand, antagonists bind to receptors but do not activate them, blocking the action of agonists. This action can be likened to placing a wedge in a door, preventing it from opening. Naloxone, for instance, is an antagonist that can reverse the effects of opioid overdose by binding to the same receptors without activating them. There are also partial agonists, which exhibit a unique characteristic. They bind to receptors and activate them, but produce a less than maximal response compared to full agonists. This creates a nuanced effect, useful in various therapeutic contexts. Imagine a dimmer switch that can brighten or dull the light, providing a more controlled illumination than a simple on and off switch could offer. Buprenorphine, a partial agonist at opioid receptors, can provide pain relief while also reducing the euphoric effects associated with full agonists, thus minimizing the potential for abuse. As we explore drug receptor interactions, it becomes evident that the consequences of binding extend beyond simple activation or inhibition. The impact of receptor binding on drug efficacy is profound. The efficacy of a drug refers to its ability to produce a desired effect once it binds to its receptor. A drug with high efficacy can lead to significant physiological changes, while one with low efficacy may result in minimal effects. Consider the role of receptor reserve, a concept that highlights how not all receptors need to be occupied for a drug to produce its maximal effect. This phenomenon allows for variability in responses among individuals, as some may require higher doses to achieve the same therapeutic effect due to differences in receptor availability or sensitivity. It raises the question of how our individual biology shapes our responses to medication. Are some of us more attuned to certain drugs, while others require a stronger push to elicit the same response? Imagine the intricate balance within our bodies as drugs interact with numerous receptors, each with its own unique identity and role. The interplay among different types of receptors can lead to complex outcomes. For instance, a drug may have multiple targets, influencing various systems simultaneously. The heart, the brain, the gut, all responding to the same chemical messenger in different ways. This multidimensional response underscores the importance of understanding the specific receptors involved when developing new therapies. In the realm of pharmacology, the work of outstanding individuals has paved the way for our understanding of these interactions. One such figure is Paul Ehrlich, whose concept of the magic bullet proposed that drugs could target specific receptors to treat diseases effectively. His vision laid the groundwork for modern drug design, emphasizing the importance of precision in targeting. Ehrlich once remarked, "To think is to act." This philosophy resonates in the contemporary pursuit of developing medications that not only address symptoms, but also target the underlying causes of diseases. As we contemplate the nuances of drug-receptor interactions, it is essential to recognize the role of receptor desensitization and downregulation. Over time, continuous stimulation of a receptor can lead to a decrease in its responsiveness, much like a well-worn path that becomes harder to traverse with each use. This phenomenon can affect drug efficacy, requiring higher doses to achieve the same therapeutic outcome. Understanding these adaptive changes in receptor behavior is crucial for developing strategies that ensure sustained effectiveness of treatments. The journey of a drug through the body is not a straightforward path. Receptors may undergo conformational changes upon binding, initiating a cascade of intracellular events that ultimately lead to the desired effect. This process can involve secondary messengers, which amplify the signal initiated by the drug-receptor interaction. Imagine a single drop of water creating ripples on the surface of a pond, where each ripple represents a series of cellular responses. Such complexity highlights the beauty of biological systems and the intricate choreography of cellular communication. Moreover, the concept of allosteric modulation introduces an additional layer of complexity to drug-receptor interactions. Allosteric modulators bind to sites distinct from the active site of a receptor, inducing conformational changes that can enhance or inhibit the receptor's response to an agonist. This mechanism opens up new avenues for drug development, allowing for the fine-tuning of receptor activity without directly competing with endogenous substances. The potential for allosteric modulators to improve therapeutic outcomes while minimizing side effects is a topic of growing interest in pharmacology. Reflecting on the broader implications of these interactions, we find ourselves at the intersection of science and healing. The quest to understand how drugs interact with receptors is not merely an academic exercise. It is a journey toward improving lives. Each discovery in this realm holds the promise of creating therapies that are more effective, safer, and tailored to individual needs. As we traverse this landscape of drug-receptor interactions, it is essential to consider the future of pharmacology. The advent of personalized medicine, where treatments are customized based on an individual's genetic makeup, underscores the importance of understanding receptor dynamics. By recognizing how variations in receptor structure and function can influence drug responses, we move closer to creating a world where medicine is not a one-size-fits-all approach, but rather a tailored experience that considers the unique biological makeup of each patient. In this evolving narrative, the intersection of science, compassion, and understanding becomes increasingly vital. The intricate dance of drugs and receptors is not just about molecules and mechanisms. It is about the lives they touch and the healing they facilitate. Each interaction is a potential story waiting to unfold, a promise of relief and recovery woven into the very fabric of our biology. As we continue this exploration, let us remain mindful of the profound impact these discoveries can have on our health and well-being, illuminating pathways toward a brighter future. The dynamic world of receptors does not exist in isolation. It is intertwined with the broader landscape of physiological systems. Each receptor interacts not only with its specific ligands, but also with a network of signaling pathways that govern countless biological processes. This interconnectedness is often illustrated by the concept of signal transduction, where the binding of a drug to a receptor triggers a series of molecular events within the cell. These events can lead to changes in gene expression, enzyme activity, or even cellular metabolism. Imagine a symphony orchestra, each musician representing a different receptor or signaling molecule, working together to create a harmonious melody. When a drug binds to its receptor, it is akin to the conductor raising the baton, signaling the musicians to begin. The resulting performance is a complex interplay of sound, reflecting the myriad responses that can occur within the body. This orchestration is crucial. To understand how drugs elicit their effects, we must consider not only the initial binding, but also the subsequent cellular responses that unfold. The diversity of receptors also plays a significant role in the complexity of drug action. There are several receptor families, including ionotropic receptors, which are directly linked to ion channels, and metabotropic receptors, which activate intracellular signaling cascades through second messengers. Ionotropic receptors can be likened to a gate that opens and closes in response to specific signals, allowing ions to flow in and out of cells, while metabotropic receptors initiate a series of events that can amplify the initial signal, akin to a ripple effect across a pond. The multifaceted nature of receptors means that a single drug can produce a variety of effects depending on the receptor type it engages with. This phenomenon highlights the importance of precision in drug design. The challenge for pharmacologists is to create compounds that selectively target specific receptors while minimizing off-target interactions that could lead to unwanted side effects. Consider the work of Sir James Black, a pioneer in the field of pharmacology, who famously remarked, "The most important thing to know about a drug is how it interacts with receptors." His innovative approach to drug discovery led to the development of beta blockers, which revolutionized the treatment of cardiovascular diseases by selectively blocking beta-adrenergic receptors. Black's insights underscore the significance of understanding receptor interactions, not just to create effective therapies, but to enhance patient safety and outcomes. As we delve deeper into the implications of drug-receptor interactions, we encounter the fascinating realm of receptor polymorphisms. These genetic variations can influence how individuals respond to medications, leading to differences in drug efficacy and safety. Imagine a world where two people take the same medication, yet one experiences relief while the other encounters adverse effects. This variability can often be traced back to subtle differences in their receptors, shaped by their genetic backgrounds. The potential for personalized medicine emerges from this understanding. By tailoring treatments to an individual's genetic profile, healthcare providers can optimize therapeutic outcomes. This approach not only promises to enhance the efficacy of medications, but also paves the way for more responsible prescribing practices, reducing the risk of adverse drug reactions. Moreover, the influence of the environment on receptor function cannot be understated. Factors such as diet, lifestyle, and exposure to toxins can alter receptor sensitivity and expression, further complicating the landscape of drug action. Imagine how a diet rich in antioxidants might enhance receptor activity, while exposure to certain chemicals could lead to downregulation. This interplay between external factors and internal biology emphasizes the necessity of a holistic approach to health and medicine. In examining drug efficacy, we must also consider the concept of therapeutic windows. This window represents the range of drug concentrations in the body where the desired therapeutic effects occur without causing toxicity. Understanding this delicate balance is vital in drug development, as a narrow therapeutic window increases the risk of adverse effects. The careful monitoring of drug levels in patients, especially those on medications with narrow therapeutic indices, becomes paramount. This is where the role of pharmacogenomics, the study of how genes affect a person's response to drugs, comes into play. By integrating genetic information with clinical practice, healthcare providers can ensure that patients receive the most appropriate doses, minimizing the chances of complications. As we reflect on the journey of drug interactions within our bodies, we find ourselves at the confluence of biology, chemistry, and individual patient care. The quest to understand these interactions is far from complete. It is an ongoing exploration that holds the promise of novel therapies and better health outcomes. Each discovery contributes to a deeper understanding of the human body and the intricate mechanisms that govern our responses to medications. In this ever-evolving narrative, the importance of collaboration among scientists, clinicians, and patients becomes increasingly clear. The shared goal of advancing medical knowledge and improving therapeutic strategies requires a multifaceted approach, where insights from one domain can illuminate paths in another. The journey of drug discovery and development is not solely a scientific endeavor. It is a compassionate pursuit aimed at enhancing lives. As we move forward in this exploration of drug-receptor interactions, let us remain open to the possibilities that lie ahead. The potential for breakthroughs in pharmacology is vast, and with each step taken, we draw closer to a future where medicines are not just treatments, but tailored solutions that resonate with the unique stories of the individuals they serve. Each interaction is a brushstroke on the canvas of health, revealing the beauty and complexity of life itself. Chapter 3: The Role of Pharmacokinetics in Drug Action. Pharmacokinetics, a term that elegantly encompasses the journey of a drug through the body, plays a vital role in understanding how medications exert their effects. It serves as a bridge connecting the moment a drug enters the body to the moment it leaves, encompassing 4 fundamental stages: absorption, distribution, metabolism, and excretion. Each stage unfolds like a chapter in a story, revealing how substances interact with our biological systems, ultimately leading to therapeutic outcomes. Imagine the moment a pill is swallowed. It is here that the journey begins in the realm of absorption. This initial stage is crucial as it determines how quickly and effectively a drug enters the bloodstream. Drugs can be absorbed through various routes, including oral, intravenous, or intramuscular methods, each with its own nuances. With oral administration, the tablet must first dissolve in the stomach, a process influenced by factors such as the drug's chemical properties and the presence of food. The drug then crosses the gastrointestinal wall into the bloodstream, where it begins its adventure throughout the body. Consider the intricate dance occurring within the digestive system. The stomach, with its acidic environment, can alter the stability of certain drugs, while the small intestine, with its vast surface area and specialized transport mechanisms, plays an essential role in maximizing absorption. For instance, some drugs are designed to be absorbed more effectively in the small intestine, where specific transport proteins facilitate their passage. This is a vivid reminder of how the body is not merely a passive recipient of medications, but an active participant in their journey. Once absorbed, the drug enters the bloodstream, and the next stage, distribution, takes center stage. This process involves the movement of the drug throughout the body's tissues and organs. The bloodstream acts as a vast highway, transporting these molecules to their intended destinations. However, not all drugs are created equal in this respect. Factors such as blood flow, tissue permeability, and binding to plasma proteins can significantly influence how widely a drug is distributed. Imagine a drug like a gentle breeze sweeping through the body's circulatory system, finding its way into various tissues. Some areas, like the brain, have unique barriers that selectively allow substances to pass, while others, like muscle or fat tissue, may retain drugs longer. This selective distribution can have profound implications for the drug's effectiveness and side effects. The renowned pharmacologist Paul Ehrlich once remarked on the blood-brain barrier, emphasizing its role as a gatekeeper, protecting the brain from harmful substances while selectively allowing beneficial compounds to enter. As the drug disperses, it eventually encounters the liver, a pivotal site for the next stage, metabolism. Here, the body transforms the drug into different chemical forms, often making it easier to excrete. Metabolism can convert active drugs into inactive metabolites, or, conversely, transform inactive compounds into active forms, a process known as bioactivation. This intricate biochemical transformation serves to regulate the duration and intensity of a drug's action. In this realm of chemical alterations, enzymes play a starring role. The liver, rich in a diverse array of enzymes, modifies drug structures through reactions such as oxidation, reduction, and hydrolysis. These processes can be influenced by a host of factors, including age, genetic variations, and even concurrent medications. Imagine a skilled artisan working meticulously to reshape a piece of wood, making it fit for its ultimate purpose. Similarly, enzymes meticulously sculpt drugs into forms that suit the body's needs. Notably, the concept of first-pass metabolism highlights how a drug's efficacy can be significantly altered before it reaches systemic circulation. When a drug is taken orally, it often passes through the liver first, where it can be extensively metabolized, reducing the concentration of active drug that eventually reaches the bloodstream. This is a crucial consideration in drug design and administration, illustrating why some medications are more effective when delivered via alternative routes, such as sublingually or intravenously. After the body has utilized the drug, the final stage of pharmacokinetics unfolds: excretion. This process involves the elimination of metabolites and unchanged drugs from the body, primarily through the kidneys, but also via the liver, lungs, and intestines. The kidneys filter blood, allowing waste products to be excreted in urine, while some drugs may be expelled through bile or even exhaled as gases. The efficiency of this elimination process can be influenced by various factors, such as kidney function, hydration levels, and the drug's chemical properties. For instance, water-soluble drugs might be excreted more readily than those that are lipophilic, which tend to be reabsorbed in the renal tubules. It is fascinating to envision how the body meticulously manages the balance of substances, ensuring that waste is cleared while retaining what is necessary for health. This interplay of pharmacokinetics highlights the profound complexity of drug action within our bodies. Each stage is interconnected, influencing how a drug is absorbed, how it spreads, how it is transformed, and ultimately how it is eliminated. Understanding these processes not only enhances our appreciation of the remarkable efficiency of our biological systems, but also illuminates the challenges faced in developing effective therapies. As we embrace this knowledge, we uncover the potential to personalize medicine, adapting treatments based on how individual patients may absorb, metabolize, and excrete different drugs. This journey through pharmacokinetics invites us to ponder the profound impact of our choices, both in the design of therapies and in the everyday lives of those who rely on medications for health and well-being. Through the lens of pharmacokinetics, we gain a deeper understanding of the delicate balance between drug efficacy and safety. It is a reminder that behind every medication lies a complex narrative, one that is shaped by the intricate workings of the human body, waiting to be discovered and understood. As we traverse deeper into the stage of metabolism, we uncover a world of transformation that is nothing short of remarkable. The liver, often dubbed the body's chemical factory, orchestrates a symphony of enzymatic reactions that modify drugs into various metabolites. This process is not random. It is an intricate response to the drug's structure and the body's needs. Imagine the liver as a master craftsman, skillfully reshaping raw materials into forms that the body can either utilize or expel. Metabolism occurs primarily through two phases, phase I and phase II. Phase I reactions, which include oxidation, reduction, and hydrolysis, introduce or expose functional groups on the drug molecules, altering their chemical structure. This phase often utilizes a family of enzymes known as cytochrome P450s, which are named for their distinctive absorption spectra. These enzymes are vital as they help navigate the complex pathways of drug metabolism. The sheer variety of cytochrome P450 enzymes is staggering, each one tailored to process specific substances. Consider the famous quote by the renowned pharmacologist and Nobel laureate, Paul Ehrlich: "The magic bullet does not exist." This notion echoes in the realm of drug metabolism, where the effectiveness of a medication can be dramatically influenced by how our bodies process it. Some individuals may metabolize a drug rapidly, requiring higher doses for therapeutic effects, while others may metabolize it slowly, leading to heightened risk of toxicity. Now, envision the second phase of metabolism, where the body further modifies these metabolites. Phase II reactions, involving conjugation, add chemical groups to the phase I metabolites, enhancing their water solubility and preparing them for excretion. This phase can include processes such as glucuronidation or sulfation, which can convert lipophilic substances into hydrophilic forms that the kidneys can readily eliminate. Imagine this phase as a final polishing of a gem, making it suitable for release and ensuring that it no longer poses a risk to the body. The interplay of genetics plays a pivotal role in this metabolic landscape. Variations in genes that encode for metabolizing enzymes can lead to significant differences in drug response among individuals. Polymorphisms in genes, sometimes referred to as genetic variants, can cause differences in enzyme activity, resulting in what is known as pharmacogenomics. This field explores how our genetic makeup influences our interaction with medications, paving the way for personalized medicine. What if we could tailor treatments to fit the unique metabolic profiles of individuals? Imagine a world where medications are chosen not just based on symptoms, but on a comprehensive understanding of how each person's body processes drugs. This is not just a distant dream. It is rapidly becoming a reality, providing hope for improved therapeutic outcomes and reduced adverse effects. As metabolism wraps up its role, we transition into the final act of pharmacokinetics, excretion. This stage represents the body's meticulous effort to eliminate drugs and their metabolites, ensuring that any potentially harmful substances are efficiently cleared. The kidneys, with their intricate filtration systems, play a central role in this process. They filter blood, allowing waste products to be excreted in urine while reabsorbing essential nutrients and water. Imagine the kidneys as diligent guardians, constantly monitoring the body's internal environment and adjusting fluid and electrolyte balances. They determine which substances to retain and which to expel, a process that is influenced by the chemical properties of the drugs involved. For instance, water-soluble drugs are typically excreted more efficiently than their fat-soluble counterparts, which may require additional metabolic conversions before elimination. The impact of kidney function on drug excretion is profound. Impaired renal function can lead to the accumulation of drugs in the body, increasing the risk of toxicity. This reality underscores the importance of considering a patient's renal health when prescribing medications. Additionally, excretion is not limited to the urinary route. Some drugs can be expelled through the bile, which is secreted into the intestines, while others may be exhaled through the lungs. Imagine the body as a complex ecosystem, where each organ plays a vital role in maintaining balance and health. The intricacies of pharmacokinetics illuminate the interdependence of absorption, distribution, metabolism, and excretion. These stages are not isolated events, but rather a continuous flow that ensures drugs are effectively utilized and safely eliminated. The understanding of these processes is crucial for healthcare professionals, enabling them to make informed decisions when prescribing and monitoring treatments. As we reflect on the journey of a drug through the body, we begin to appreciate the delicate harmony of biological systems that govern drug action. Each stage of pharmacokinetics informs and enhances our understanding of therapeutic efficacy and safety. Consider the profound implications of this knowledge. By embracing the complexities of pharmacokinetics, we open the door to a world of possibilities in drug development and personalized therapy. This journey invites us to imagine a future where medications are not merely prescribed, but finely tuned to the unique profiles of each patient, ensuring that the magic of healing can be achieved with precision and care. As we delve further into the landscape of pharmacokinetics, we are reminded that every drug's journey is unique, shaped by myriad factors, including genetic makeup, environmental influences, and individual health status. This intricate interplay not only affects how drugs work, but also how we, as patients, experience treatment. Through this understanding, we can foster a deeper empathy for those navigating their own paths in the world of medicine, recognizing the complexities that lie beneath the surface of each therapeutic choice. Chapter 4: Biochemical Pathways Influenced by Drugs. In the intricate landscape of our bodies, biochemical pathways weave together the very fabric of life. These pathways consist of a series of chemical reactions that transform substances, enabling cells to grow, reproduce, and respond to their environment. Imagine these pathways as bustling highways, each carrying vital nutrients and signals essential for maintaining our biological functions. Some pathways are straightforward, while others branch out into complex networks, illustrating the beauty and complexity of life itself. At the heart of these biochemical highways lie enzymes, the catalysts that facilitate reactions. They accelerate processes, ensuring that our metabolism runs smoothly. Without enzymes, many reactions would occur too slowly to sustain life. Each enzyme is specific to a particular reaction, akin to a conductor guiding an orchestra. The interplay of these enzymes and their substrates forms the basis of metabolic processes, including the breakdown of food into energy and the synthesis of necessary biomolecules. Drugs, in their myriad forms, can modify these pathways in profound ways. When a drug enters the body, it can influence the activity of specific enzymes, either enhancing or inhibiting their function. This modulation can lead to significant changes in metabolic pathways. Imagine a tiny molecule entering a busy intersection, redirecting traffic in unexpected ways. This redirection can open new avenues for therapeutic intervention. Consider the role of a common class of drugs known as statins. These medications are designed to lower cholesterol levels by inhibiting an enzyme called HMG-CoA reductase, a crucial player in the cholesterol synthesis pathway. By blocking the action of this enzyme, statins effectively reduce the production of cholesterol, leading to lower levels circulating in the bloodstream. This simple yet effective modification of a metabolic pathway can significantly reduce the risk of cardiovascular diseases. Another compelling example can be found in the realm of cancer treatment. Certain chemotherapeutic agents target the folate pathway, crucial for DNA synthesis and repair. Methotrexate, for instance, acts as a potent inhibitor of dihydrofolate reductase, an enzyme pivotal in the synthesis of tetrahydrofolate. By disrupting this pathway, methotrexate slows down the proliferation of rapidly dividing cancer cells. This therapeutic strategy exemplifies how understanding biochemical pathways allows for targeted approaches in treating diseases. The implications of pathway modulation extend far beyond single drugs. The way these agents interact with metabolic pathways can illuminate new avenues for therapy. When drugs are used in combination, they can create synergistic effects, amplifying their therapeutic benefits. This concept is vividly illustrated in the treatment of HIV, where a cocktail of antiretroviral drugs targets multiple pathways involved in viral replication. By attacking the virus from different angles, these drugs work together to suppress viral load and enhance patient outcomes. As we reflect on these examples, one might wonder how alterations in biochemical pathways can lead to side effects. The body is a finely tuned machine where every change can have ripple effects. For instance, while statins effectively lower cholesterol, they can also affect other pathways involved in muscle metabolism, potentially leading to muscle pain or weakness in some patients. This highlights the delicate balance within our biochemical systems and underscores the importance of personalized medicine. Understanding an individual's unique metabolic profile can guide therapeutic decisions, helping to minimize side effects while maximizing efficacy. The study of biochemical pathways influenced by drugs also opens the door to innovative research. Scientists are continually exploring how to manipulate these pathways to create new therapies. One particularly exciting area of research is the use of gene editing technologies, such as CRISPR. These tools hold the potential to directly alter genes involved in specific metabolic pathways, ushering in a new era of precision medicine. Imagine the possibilities of correcting genetic mutations that lead to metabolic disorders, effectively rewriting the underlying biological narratives of patients' lives. As we ponder these advancements, it is essential to recognize the outstanding individuals who have contributed to our understanding of biochemical pathways and drug interactions. One such luminary is Paul Ehrlich, known for his pioneering work in developing targeted therapies. He famously stated, "The future of medicine is no longer about treating symptoms, but about understanding the underlying mechanisms of disease." This vision has driven countless researchers to delve deeper into the molecular underpinnings of health and disease, ultimately shaping the evolution of pharmacology. The interplay between drugs and biochemical pathways is a complex yet fascinating dance, filled with potential for discovery and healing. Each new insight brings us closer to understanding how we can harness these pathways for therapeutic benefit. As we continue to explore this intricate landscape, we can envision a future where treatments are tailored to individual metabolic profiles, leading to improved health outcomes and a better quality of life. In this beautiful journey of discovery, one may wonder about the ethical considerations that arise from manipulating biochemical pathways. As we gain the ability to alter these pathways through innovative technologies, the responsibility to use such power wisely becomes paramount. The potential for unintended consequences, such as off-target effects in gene editing, calls for a cautious and thoughtful approach. Engaging in dialogue about the ethical implications of our advancements will ensure that we navigate this new terrain with care and integrity. The exploration of biochemical pathways influenced by drugs not only enriches our understanding of pharmacology, but also invites us to reflect on the broader implications of our discoveries. The interconnectedness of life, health, and science reminds us that every action we take within this intricate web has the potential to create far-reaching effects. As we continue to journey through the realms of drug action and metabolism, we unravel not only the mysteries of our bodies, but also the profound relationships that bind us to the very essence of life itself. As we traverse the landscape of biochemical pathways, it is essential to recognize that not all drugs act in isolation. The intricate web of interactions between different drugs can lead to unexpected outcomes, both beneficial and detrimental. For instance, consider the field of pain management. Opioids, a class of drugs known for their potent analgesic effects, act primarily by binding to opioid receptors in the brain and spinal cord, dampening the perception of pain. Yet, when prescribed alongside non-steroidal anti-inflammatory drugs, their effects can be amplified, leading to greater pain relief. However, this combination can also increase the risk of adverse effects, such as gastrointestinal issues or the potential for dependency. How do we strike a balance between maximizing therapeutic benefit and minimizing harm? One avenue of exploration lies in the realm of pharmacogenomics, the study of how an individual's genetic makeup influences their response to drugs. Imagine a world where treatments are customized based on a person's unique genetic profile. This approach has the potential to revolutionize how we prescribe medications, allowing for a more precise targeting of biochemical pathways. For example, individuals with specific genetic markers may metabolize certain drugs more rapidly or slowly, affecting their efficacy and safety. The promise of personalized medicine encourages us to move away from a one-size-fits-all model, ushering in an era where therapy is tailored to the individual. The modulation of biochemical pathways through drugs also invites us to consider the broader implications for chronic diseases. Conditions such as diabetes exemplify how targeted therapies can influence metabolic pathways to manage long-term health. Metformin, a cornerstone in diabetes treatment, acts primarily by enhancing insulin sensitivity and reducing hepatic glucose production. By influencing these specific pathways, metformin not only helps regulate blood sugar levels, but also may offer protective cardiovascular effects. This dual action exemplifies the potential of drugs to address multiple facets of a disease, promoting a holistic approach to treatment. As we delve into the complexities of drug interactions and their effects on biochemical pathways, it is crucial to highlight the role of research in shaping our understanding of these processes. The work of scientists like Sir James Black, who received a Nobel Prize for his contributions to drug development, underscores the importance of targeted therapies. His assertion that the best drug is one that is used for the right patient at the right time resonates deeply within the medical community, emphasizing the need for precision in pharmacotherapy. We must also consider the implications of long-term drug use on health and biochemical pathways. Chronic exposure to certain medications can lead to adaptive changes in the body, affecting how we respond to different drugs over time. Take corticosteroids, often prescribed to reduce inflammation. While they can provide relief, long-term use can lead to metabolic changes, such as weight gain and altered glucose metabolism. This phenomenon raises the question: how do we ensure that the benefits of a drug outweigh the risks associated with prolonged use? The exploration of biochemical pathways influenced by drugs naturally leads us to contemplate the future of drug discovery. With advances in technology, particularly in artificial intelligence and machine learning, researchers are now able to analyze vast datasets to identify new pathways and potential therapeutic targets. Imagine algorithms capable of predicting how new compounds will interact with specific biochemical pathways, streamlining the drug development process. This shift has the potential to accelerate the creation of innovative therapies while reducing the time and cost associated with bringing new drugs to market. Moreover, the integration of systems biology, which examines complex interactions within biological systems, is paving the way for a more comprehensive understanding of drug actions. By considering the broader context of how drugs influence entire networks of biochemical pathways, researchers can develop strategies that enhance therapeutic efficacy while minimizing side effects. This holistic perspective not only enriches our knowledge of pharmacology, but also encourages collaboration across disciplines, fostering a culture of innovation in drug development. As we navigate this intricate interplay between drugs and biochemical pathways, it is essential to remember the human element at the core of this journey. Behind every discovery lies a story of perseverance, curiosity, and the unwavering desire to improve health outcomes. The commitment of researchers and healthcare providers to unravel the complexities of drug action and metabolism illuminates a path toward a healthier future for all. In this evolving landscape, one may ask how we can foster a greater understanding of the biochemical processes at play within our own bodies. Education plays a pivotal role in bridging the gap between scientific discovery and public awareness. By empowering individuals with knowledge about how drugs work, we can cultivate informed patients who actively participate in their healthcare decisions. Imagine a society where patients engage in meaningful dialogues with their healthcare providers, armed with an understanding of the biochemical pathways that underpin their treatments. As we reflect on the vast potential of drugs to modulate biochemical pathways, we are reminded of the delicate balance that exists within our bodies. Each pathway is a thread in the intricate fabric of life, and every intervention carries the weight of consequence. The exploration of this intricate web not only enhances our understanding of pharmacology, but also invites us to consider the ethical dimensions of drug development and use. How do we ensure that our pursuit of knowledge and innovation serves the greater good? This question underscores the importance of ethical considerations in guiding our scientific endeavors. In the heart of this exploration lies a profound opportunity for discovery and healing. By continuing to investigate the nuances of biochemical pathways and their interactions with drugs, we pave the way for a future where treatments are no longer merely reactive, but rather proactive, tailored to the unique needs of each individual. The journey through the realms of pharmacology is ongoing, rich with the promise of new knowledge and the potential for transformative change. Chapter 5: The importance of drug dosage and administration. The journey of a drug does not simply end once it binds to its target receptor. It continues as the body processes and responds to this foreign substance. Central to the successful use of medications is the careful consideration of drug dosage and administration, factors that play a crucial role in achieving the desired therapeutic effects. Imagine, for a moment, the delicate balance required in determining the appropriate dosage of a medication. Various factors come into play, each influencing how a drug performs within the body. Individual patient characteristics such as age, weight, sex, and overall health status contribute significantly to how a person will metabolize and respond to a medication. For instance, consider the elderly population, whose bodies may process drugs differently due to changes in liver and kidney function. Similarly, the presence of other medical conditions or concurrent medications can lead to interactions that affect drug efficacy and safety. Genetic variations also play a pivotal role in drug response, a concept known as pharmacogenomics. Each individual's genetic makeup can influence how they metabolize drugs, leading to different responses. Some may require higher doses for effectiveness, while others may experience adverse effects even at standard dosages. The notion that one size fits all does not apply neatly in the realm of pharmacology. Instead, personalized medicine is gaining traction, aiming to tailor drug therapies based on genetic profiles. Routes of administration further complicate the dosage equation. The method by which a drug is delivered into the body can significantly affect its absorption and distribution. Oral medications, while convenient, must first navigate the complexities of the gastrointestinal tract, where factors such as gastric pH and food interactions can hinder their efficacy. In contrast, intravenous administration delivers drugs directly into the bloodstream, allowing for rapid onset of action. This method is particularly useful in emergency situations or when a precise dosage is required. Imagine the difference in effect when a pain-relieving medication is given orally versus intravenously. When taken orally, the drug must traverse the digestive system, potentially losing some potency along the way. Conversely, an intravenous injection ensures immediate availability in the bloodstream, providing rapid relief. The choice of administration route can also influence the duration of the drug's effect. Some medications are designed to be long-acting, while others may provide immediate relief but require frequent dosing. As we consider drug dosage, we must also explore the concept of the therapeutic window. This term refers to the range of doses that produces the desired effect without causing toxicity. Imagine a narrow bridge where the path to healing lies between the dangers of underdosing and overdosing. The therapeutic window is unique to each drug, influenced by its pharmacokinetics and pharmacodynamics. Finding this balance is critical. Too little of a medication may result in insufficient therapeutic response, while too much can lead to adverse effects or toxicity. It is a tightrope walk that healthcare professionals must navigate, often requiring close monitoring of patient responses and adjustments in dosages. For example, in the case of anticoagulants, a medication that prevents blood clotting, the therapeutic window is particularly narrow. Too little may lead to dangerous clot formation, while too much can precipitate uncontrolled bleeding. The consequences of underdosing or overdosing are profound and can have lasting impacts on patient health. Underdosing can lead to treatment failure, prolonging suffering and allowing diseases to progress unchecked. Picture a patient with chronic pain who receives an insufficient dose of their analgesic. The result may be not only continued discomfort, but also a decreased quality of life, impacting their ability to engage in daily activities. Conversely, consider the effects of overdosing, which can be equally alarming. An overdose may lead to toxicity, manifesting in symptoms that range from mild discomfort to life-threatening conditions. The story of opioid medications provides a stark illustration of this reality. While they are effective for pain management, the risk of overdose looms large, with potentially fatal consequences. The need for careful monitoring and education around these drugs is paramount to ensuring patient safety. In the realm of mental health, the importance of appropriate dosing is underscored by the use of antidepressants. These medications often require time to reach their full effect, and finding the right dosage can take weeks or even months. Imagine the frustration of a patient who is told to be patient while their medication takes effect, only to find that they remain in a state of despair. The delicate art of titration, adjusting the dose based on response, requires a careful touch and empathetic understanding from healthcare providers. In addition to individual patient factors and routes of administration, external elements such as environmental factors and lifestyle choices can also influence drug efficacy. Consider how stress, diet, and physical activity can alter how a drug is metabolized. A healthy diet rich in nutrients can enhance the body's ability to process medications, while excessive alcohol consumption may hinder their effectiveness. Healthcare professionals must consider these myriad factors when prescribing medications, ensuring that their patients receive the best possible care. Collaboration between patients and providers is key, fostering an open dialogue about concerns, experiences, and preferences. This partnership can lead to more effective treatment plans, enhancing the overall therapeutic experience. As we reflect on the intricacies of drug dosage and administration, we are reminded of the profound responsibility that comes with prescribing medications. Each decision carries weight, influencing not only biochemical pathways, but also the lives and well-being of individuals. The importance of understanding these concepts cannot be overstated. They are essential to the practice of medicine and the pursuit of healing. In this vast and complex landscape, we can draw inspiration from the words of esteemed pharmacologist Sir James Black, who once said that the most important aspect of drug development is the choice of the right target. This principle, applies not only to the development of new medications, but also to their use, highlighting the necessity of choosing the right dosage and administration route to maximize therapeutic benefits while minimizing risks. The delicate interplay of factors influencing drug dosage and administration serves as a reminder of the intricate web of systems that govern our bodies. It is a testament to the beauty of science and the art of medicine, where understanding and empathy converge to create pathways of healing. Each medication tells a story, and it is our collective responsibility to ensure that these stories unfold in the most beneficial and safe manner possible. The intricate balance of drug dosage and administration extends into a realm where the therapeutic window becomes paramount. This concept not only highlights the importance of effective treatment, but also emphasizes the necessity of caution. The therapeutic window is often depicted as a delicate balance beam, where a precise dosage must be maintained to ensure its beneficial effects. Imagine the consequences of straying from that path. Each drug possesses a unique therapeutic window, defined by the relationship between its efficacy and potential toxicity. This relationship is influenced by various factors, including the drug's pharmacokinetics, the journey of the drug through the body, and its pharmacodynamics, which describes the effects it has once it reaches its target. Consider, for instance, how a medication like lithium, used to treat bipolar disorder, requires meticulous monitoring. The dosage must be carefully calibrated to avoid the pitfalls of toxicity, which can lead to severe side effects, while still providing effective mood stabilization. The importance of understanding the therapeutic window can be illustrated through the lens of cancer treatment. Chemotherapy drugs, known for their potency, often operate within a narrow therapeutic range. An insufficient dose may allow cancer cells to survive and proliferate, while an excessive dose might devastate healthy tissues, leading to debilitating side effects. This precarious balance demands a comprehensive understanding of both the drug and the patient. It's fascinating to think of how different routes of administration can further influence this delicate balance. The method by which a drug is administered can dramatically alter both its therapeutic efficacy and safety profile. For example, subcutaneous injections deliver medication into the tissue layer between the skin and muscle, offering a slower absorption rate compared to intravenous methods. This slower release can be beneficial for drugs that require a steady, prolonged effect, reducing the spikes and troughs associated with oral dosing. Imagine the comfort of a patient receiving a slow-release formulation of a medication for chronic pain. This approach not only alleviates discomfort, but also minimizes the risk of underdosing or overdosing. By maintaining stable drug levels in the bloodstream, healthcare providers can enhance therapeutic outcomes while reducing the likelihood of adverse effects. The consequences of both underdosing and overdosing extend beyond immediate health impacts. They can profoundly affect the patient's psychological well-being and trust in the healthcare system. Picture a patient who feels their pain is not adequately addressed due to underdosing. Over time, this can lead to frustration and a sense of helplessness. On the other hand, the fear of overdose can create anxiety, particularly in patients who may already be vulnerable. Communication plays an essential role in addressing these concerns. Healthcare providers must engage in open conversations with patients, discussing the importance of adherence to prescribed dosages and the potential consequences of deviations. This dialogue fosters a sense of partnership, empowering patients to take an active role in their treatment journey. The impact of lifestyle choices on drug efficacy cannot be overstated. Factors such as diet, exercise, and even sleep can significantly influence how medications function within the body. For instance, grapefruit juice is known to interact with various medications, potentially leading to increased blood levels of the drug and heightening the risk of toxicity. Similarly, a diet low in essential nutrients may impair the body's ability to metabolize certain drugs effectively. Imagine the power of a well-balanced diet, rich in vitamins and minerals, to enhance the therapeutic effects of medications. A patient who understands this connection may be more inclined to embrace healthier lifestyle choices, ultimately benefiting their treatment outcomes. As we explore these themes, the stories of individuals who have navigated the complexities of drug dosage and administration emerge. Consider the work of Dr. Paul Ehrlich, a pioneer in pharmacology who famously sought to develop targeted therapies that would minimize side effects while maximizing therapeutic benefits. His vision of tailored medicine echoes today in the ongoing quest for precision medicine, where understanding a patient's unique profile can lead to more effective dosing strategies. The narrative of drug dosing also beckons us to reflect on the implications of technology in modern medicine. With advancements in pharmacogenomics, we are now equipped to assess genetic variations that influence drug metabolism. This information empowers healthcare providers to personalize treatment plans, ensuring that each patient receives the optimal dosage for their unique genetic makeup. Imagine a world where a simple genetic test can guide a physician in selecting the most effective medication and dosage for each individual. This transformative approach not only enhances the efficacy of treatments, but also minimizes the risk of adverse drug reactions. However, the journey toward personalized medicine is fraught with challenges. Ethical considerations arise when discussing genetic testing and its implications for privacy and access to care. As we move forward, it is vital to balance innovation with responsibility, ensuring that advancements benefit all patients, regardless of their background or circumstances. In this expansive landscape of drug dosage and administration, the threads of individual responsibility, healthcare collaboration, and scientific innovation intertwine. Each medication represents a promise of relief, healing, and improved quality of life. Yet, with that promise comes the weight of responsibility. The importance of understanding drug dosage and administration is a testament to the intricate relationship between science and humanity. It is a reminder that behind every prescription lies a story of careful consideration, empathy, and the relentless pursuit of better health outcomes. As we continue this journey, we remain dedicated to unraveling the complexities of pharmacology, aiming always to enhance the experience of healing for every patient who seeks our care. Chapter 6: Drug Interactions, Synergy and Antagonism. In the intricate landscape of medicine, drug interactions emerge as complex phenomena that can significantly influence therapeutic outcomes. At their core, drug interactions can be defined as the ways in which one drug affects the activity of another when both are present in the body. These interactions can be categorized into two primary types: synergy and antagonism. Synergistic interactions occur when the combined effect of two drugs is greater than the sum of their individual effects. In contrast, antagonistic interactions arise when one drug diminishes the effect of another. Both types of interactions can have profound implications for treatment strategies, patient safety, and overall health. Imagine a symphony orchestra where each musician plays a unique instrument, contributing to a harmonious performance. In drug synergy, the collaboration between drugs can lead to an amplified therapeutic effect. For instance, consider the case of antibiotics. When two antibiotics are used together, they may target different aspects of bacterial metabolism, resulting in a more effective elimination of the infection. This cooperative interaction is not merely additive. Rather, it creates a powerful force against pathogens, helping to overcome resistance and enhance treatment efficacy. Clinical trials have demonstrated that certain combinations of chemotherapy agents can have synergistic effects, improving survival rates in cancer patients. As one prominent oncologist noted, the goal is not just to fight the disease, but to do so in a way that enhances the patient's quality of life. To visualize the concept of drug synergy, imagine two rivers merging into a larger stream. Each river carries its own nutrients and energy, but together they create a flow that is more robust and powerful. This principle can be applied to various therapeutic areas, from pain management to managing chronic conditions. In pain relief, for example, combining an opioid with an NSAID can often yield better results than either drug alone, allowing for lower doses and reduced side effects. This idea of combining therapies to achieve better results reflects a growing understanding of the intricate nature of drug interactions. On the other side of the spectrum lies drug antagonism, where the presence of one drug inhibits or counteracts the effects of another. This interaction can pose significant challenges in clinical settings. Imagine trying to turn up the volume on a radio while someone else is simultaneously turning it down. In this scenario, the therapeutic effects of one drug are muted by the antagonistic influence of another. For example, the use of certain medications to lower blood pressure can be undermined by the concurrent administration of non-steroidal anti-inflammatory drugs, which may elevate blood pressure in some individuals. Such interactions can complicate treatment plans and necessitate careful monitoring. Understanding the mechanisms behind drug antagonism is crucial for healthcare providers. Often, these interactions occur at the receptor level, where one drug may compete with another for binding or alter the receptor's conformation, reducing the overall effect. Consider the case of opioid analgesics and opioid antagonists. While opioids relieve pain by binding to specific receptors in the brain, antagonists like naloxone can effectively block these receptors, reversing the effects of opioids. This dynamic showcases the delicate balance that must be maintained in pharmacotherapy, where the goal is to harness the beneficial effects of drugs while minimizing potential harm. As we explore the clinical significance of drug interactions, it becomes evident that awareness and understanding are paramount. The potential for synergy and antagonism underscores the importance of comprehensive patient assessments and thorough medication reviews. Healthcare professionals must remain vigilant to the myriad factors that can influence drug interactions, including patient-specific variables such as genetics, age, and concurrent medications. For instance, genetic differences can affect how individuals metabolize certain drugs, leading to variations in efficacy and safety. A classic example is the way some people metabolize warfarin, an anticoagulant, at different rates due to genetic variations in liver enzymes. This highlights the necessity of personalized medicine, where treatments are tailored to the unique genetic profiles of patients. Imagine a patient embarking on a new treatment regimen. They are prescribed a combination of medications aimed at managing their chronic condition. However, unbeknownst to them, one of these medications may interact negatively with another, leading to reduced effectiveness or unwanted side effects. This scenario is not uncommon, and it emphasizes the need for proactive communication between patients and healthcare providers. Patients should be encouraged to discuss all medications, including over-the-counter drugs and supplements, with their healthcare team. This open dialogue can help identify potential interactions before they become problematic. The rise of digital health technologies also plays a vital role in enhancing our understanding of drug interactions. With the advent of electronic health records and decision support systems, healthcare providers can access real-time information about potential drug interactions, ensuring safer prescribing practices. These tools serve as a safety net, helping to identify any possible pitfalls in medication regimens and allowing for timely adjustments. As we consider the future of pharmacotherapy, the exploration of drug interactions remains a critical area of research. Scientists continue to investigate the complexities of drug synergy and antagonism, seeking to unlock the potential for more effective and safer treatment strategies. Through innovative approaches, such as combination therapies and personalized medicine, the field is poised to make significant strides in improving patient outcomes. In this ever-evolving landscape, the stories of outstanding individuals in pharmacology remind us of the human element behind the science. Pioneers in drug development and pharmacology have sought to unravel the mysteries of drug interactions, pushing the boundaries of what is known. Their discoveries not only enhance our understanding, but also inspire future generations to continue the quest for knowledge. As we reflect on the dynamics of drug interactions, we are reminded of the intricate dance that occurs within our bodies, where chemicals, receptors, and pathways intertwine to create a symphony of effects. Each drug, much like a note in a melody, contributes to the overall harmony of treatment, but it is the interplay of these notes that creates the most beautiful music. So, as we navigate this complex landscape, let us remain curious and open to the possibilities that lie ahead. The world of drug interactions is rich with potential, offering insights that can lead to transformative therapies and improved health for countless individuals. The journey of understanding continues, and with it, the promise of a brighter future in the realm of medicine awaits. In the realm of pharmacology, understanding drug interactions extends beyond mere definitions. The intricate dance of synergy and antagonism reveals a deeper narrative about how drugs can work together or against one another. The mechanisms of drug synergy often hinge on various biological processes, including pharmacodynamics and pharmacokinetics. When two drugs share similar pathways or mechanisms, they can complement each other's actions, amplifying therapeutic benefits. This is often seen in patients undergoing treatment for chronic diseases, where a combination of medications can target multiple pathways simultaneously, enhancing the overall efficacy of treatment. Consider the example of treating hypertension with a combination of a diuretic and a calcium channel blocker. The diuretic works by promoting the excretion of sodium and water, thereby reducing blood volume. At the same time, the calcium channel blocker relaxes the blood vessels, leading to decreased resistance and lower blood pressure. Together, these drugs create a much more potent effect than either would alone, illustrating the beauty of pharmacological synergy. Yet, the story of drug interactions is not solely one of cooperation. Antagonism, on the other hand, poses significant challenges in clinical practice. Many patients may be unaware that their medications can interfere with one another, leading to unpredictable outcomes. Take the scenario of a patient on anticoagulants who begins taking an herbal supplement like St. John's wort. While St. John's wort is often used to alleviate symptoms of depression, it can significantly reduce the effectiveness of anticoagulants by inducing enzymes that metabolize these drugs more rapidly. Such interactions can potentially place patients at greater risk for thromboembolic events. Reflecting on the clinical significance of drug interactions brings forth the essential role of healthcare providers in safeguarding patient health. Continuous education and awareness are crucial to navigate this complex landscape. Healthcare professionals must remain attuned to the evolving nature of drug interactions, ensuring they can predict and mitigate potential adverse effects. The challenge lies in the fact that pharmacogenomics is continually advancing our understanding of how individual genetic variations can influence drug interactions. Imagine a world where each patient receives not only the appropriate medication, but also a tailored approach that considers their unique genetic makeup. This level of personalization can lead to safer prescribing practices, as well as improved therapeutic outcomes. Genetic testing can provide insights into how a patient metabolizes certain drugs, which can help guide decisions regarding medication choice and dosing. The journey of a drug in the body is not only about its chemical properties, but also about the individual who receives it. As we delve into the clinical implications of drug interactions, the importance of patient education becomes paramount. Patients should be empowered to ask questions and engage in discussions about their treatment plans. They should be encouraged to provide complete information about all medications, supplements, and lifestyle factors that could influence their therapy. This collaborative approach fosters a more comprehensive understanding of how drugs work in concert or contention within the body. In recent years, the emergence of technology has opened new avenues for enhancing patient safety. Digital health records now allow for real-time monitoring of potential drug interactions, enabling healthcare providers to make informed decisions quickly. Imagine a scenario where a physician can instantly access a patient's complete medication history, identifying potential interactions before prescribing a new medication. This proactive approach not only reduces the risk of adverse effects, but also builds a stronger relationship between patients and their healthcare providers. The exploration of drug interactions continues to be a vibrant field of research. Scientists are actively investigating new combinations of existing drugs to uncover synergistic effects that could revolutionize treatment protocols. The understanding of how certain drugs can enhance or inhibit each other's actions is paving the way for innovative therapies, particularly in oncology, where combination treatments are becoming increasingly common. One of the most notable figures in this arena is the late Paul Ehrlich, who famously stated, "One man, one drug." This emphasis on precision medicine resonates deeply as we continue to seek the optimal balance of drug interactions that maximize therapeutic effects while minimizing risks. The pursuit of knowledge in pharmacology remains an ongoing journey, with each discovery serving as a stepping stone toward more effective healthcare solutions. As we ponder these interactions, let us visualize the interconnectedness of our biological systems. Each drug behaves like a conversational partner in a dialogue, influencing and being influenced by the presence of others. This dynamic interplay creates an environment where understanding the nuances of drug interactions becomes essential. In this evolving landscape, researchers are also keenly aware of the importance of studying drug interactions in diverse populations. Differences in ethnicity, age, and comorbidities can significantly influence how drugs interact within the body. For instance, certain medications may exhibit different effects in older adults compared to younger individuals, necessitating a more nuanced approach to prescribing. Furthermore, the rise of precision medicine emphasizes the significance of understanding drug interactions at a molecular level. As technology advances, researchers are utilizing sophisticated modeling techniques to simulate drug interactions within biological systems. These simulations provide insights into how drugs may behave in the presence of others, helping to predict potential interactions before they occur in real-world scenarios. As we immerse ourselves in these concepts, let us take a moment to reflect on the profound impact that drug interactions have on our health. They are not merely scientific phenomena, but rather stories of collaboration and conflict within our bodies. The delicate balance between synergy and antagonism speaks to the artistry of pharmacology, where understanding leads to empowerment. In the ever-expanding field of medicine, the promise of new discoveries continues to illuminate the path forward. The future of drug interactions holds the potential for safer, more effective therapies that cater to the intricacies of the human experience. Each day brings us closer to understanding this complex web, and with it, the hope of enhancing the lives of countless individuals through informed, compassionate care. Chapter 7: The Immune System and Drug Action. In the delicate interplay between the immune system and drug action, we find a fascinating realm where the body's defenses meet the transformative capabilities of pharmaceuticals. Imagine the immune system as a vigilant guardian, constantly on alert, ready to respond to any intruders that threaten our health. This intricate network of cells and proteins works tirelessly, identifying pathogens, neutralizing them, and repairing any damage they may cause. Yet, when we introduce drugs into this dynamic system, the relationship becomes complex. Drugs can either bolster this natural defense or inadvertently disrupt it. The interaction between drugs and the immune system is a two-way street. On one hand, certain medications are designed to enhance immune responses. These immunomodulators play a pivotal role in treating conditions where the immune system is underactive or dysfunctional. For instance, in cases of autoimmune diseases, where the body mistakenly attacks its own tissues, immunomodulators can recalibrate the immune response, restoring balance. Imagine a conductor guiding an orchestra, bringing harmony to the chaos of competing sounds. Just as a skilled conductor can adjust the volume and tempo of musicians to create a masterpiece, immunomodulators fine-tune the immune system, allowing it to function optimally. On the other hand, some drugs may suppress immune activity. This suppression can be crucial in circumstances where the body's immune response is overly aggressive, leading to damage instead of healing. Corticosteroids, for example, are commonly used in inflammatory conditions to reduce swelling and pain by dampening immune activity. This suppression, however, can leave the body more susceptible to infections, creating a delicate balance between alleviating symptoms and maintaining overall health. As we consider the role of these drugs, we might ask, how do we find that balance? The answer lies in understanding the specific mechanisms of drug action and tailoring treatments to individual needs, much like a tailor crafting a suit that fits perfectly. Vaccines represent another fascinating aspect of the immune system's interplay with drug action. These therapeutic agents are designed to train the immune system to recognize and combat pathogens effectively, providing a proactive approach to disease prevention. Imagine a soldier preparing for battle, armed with knowledge of the enemy's tactics and strategies. Vaccines function similarly, equipping the immune system with a memory of specific pathogens, allowing for a swift and effective response upon future encounters. The development of vaccines has been one of the most significant achievements in medicine, saving countless lives and reducing the burden of infectious diseases. As we explore the history of vaccines, we encounter remarkable figures such as Edward Jenner, who pioneered the smallpox vaccine, a groundbreaking achievement that laid the foundation for modern immunization practices. Jenner's work not only showcased the potential of vaccines, but also highlighted the importance of understanding the immune system's intricacies. His insights remind us that the immune response is not merely a passive reaction, but an active and intelligent process capable of learning and adapting. Despite these successes, challenges remain in drug development for immune-related diseases. The immune system's complexity poses significant hurdles, as it is not a singular entity, but a dynamic and multifaceted network. This complexity can lead to unpredictable outcomes when developing new therapies. For instance, some drugs may work well in laboratory settings, but fail in human trials due to unforeseen interactions within the immune system. Furthermore, the diversity of individual immune responses complicates the creation of one-size-fits-all treatments. Each person's immune system is shaped by a myriad of factors, including genetics, environment, and previous exposures to pathogens. This individuality means that a drug effective for one person may not yield the same results for another, raising critical questions about personalization in medicine. How can we ensure that treatments are tailored to the unique immunological landscape of each patient? One innovative approach lies in the field of precision medicine, which seeks to customize healthcare based on individual profiles. By leveraging advances in genomics and biomarkers, researchers aim to identify which patients are most likely to benefit from specific immunomodulators or vaccines. This tailored approach has the potential to transform the landscape of treatment for immune-related diseases, paving the way for more effective and safer therapies. Moreover, the rise of biotechnological advancements has opened new doors for drug development in this arena. Monoclonal antibodies, for example, are engineered to target specific components of the immune system, offering a novel mechanism for modulating immune responses. These antibodies can be designed to either enhance or suppress activity, depending on the therapeutic need. Imagine them as precision tools in a craftsman's workshop, each designed for a specific purpose, capable of creating intricate and personalized solutions. However, the road ahead is fraught with challenges. The development of these advanced therapies requires extensive research and testing to ensure safety and efficacy. Clinical trials, often lengthy and complex, must navigate the intricacies of immune responses in diverse populations. Additionally, there are ethical considerations surrounding the use of immunomodulators, particularly in vulnerable populations such as children or the elderly. How do we balance innovation with safety? The answer lies in rigorous scientific inquiry and a commitment to ethical standards. The intersection of the immune system and drug action is a landscape rich with possibilities and challenges. It invites us to ponder the intricate connections that define our health and well-being. The immune system, in its complexity, is a testament to the body's remarkable ability to protect itself, while drugs represent our quest to harness that power for healing. The journey continues as researchers and clinicians strive to unlock the mysteries of this relationship, aiming to develop therapies that not only treat disease, but also enhance the very mechanisms that defend our health. As we reflect on this interplay, we are reminded of the words of Louis Pasteur, who once said, "Science knows no country, because knowledge belongs to humanity and is the torch which illuminates the world." In this spirit, the quest to understand the immune system and its interaction with drugs is a collective endeavor that transcends borders, uniting scientists, healthcare providers, and patients in the pursuit of a healthier future. Imagine the possibilities that lie ahead as we continue to explore and expand our understanding of this vital connection. The journey of understanding the immune system and drug action is not without its complexities and challenges. Yet, it is within this intricate web that remarkable breakthroughs continue to emerge, offering hope and new avenues for treatment. As we delve further into this realm, we encounter immunomodulators, a class of drugs designed specifically to enhance or suppress various aspects of the immune response. Immunomodulators can be likened to skilled artisans, shaping the immune system with precision. They can stimulate immune activity, especially in cases where the body's defenses are weakened or compromised. In the face of infections or malignancies, these agents can rally the body's immune forces, promoting a robust response. Consider the role of interferons, a type of immunomodulator used in the treatment of certain viral infections and cancers. These proteins, produced naturally by the body, can be administered as drugs to enhance the immune response. They act like sentinels, alerting the immune system to the presence of pathogens and encouraging the proliferation of immune cells, which in turn fortifies the body's defenses. Conversely, there are scenarios where the immune system's response must be tempered. In autoimmune diseases, for instance, the immune system mistakenly targets the body's own tissues, leading to inflammation and damage. Here, immunomodulators take on a different role, acting as peaceful mediators that suppress inappropriate immune activity. Drugs such as methotrexate and azathioprine exemplify this approach, helping to re-establish balance within the immune system. These medications can be seen as gentle guides, steering the immune response away from self-destruction and toward healing. Yet, the journey of developing effective immunomodulators is fraught with challenges. Scientists grapple with the delicate balance of stimulating the immune system without triggering harmful side effects. This balancing act is reminiscent of walking a tightrope, where the stakes are high and the margin for error is slim. How can researchers ensure that these drugs provide the intended benefits without compromising the body's overall health? The answer lies in rigorous research, where each discovery contributes to a growing understanding of the immunological landscape. Vaccines, too, represent a cornerstone of therapeutic approaches that leverage the immune system. These agents have transformed public health, providing a proactive strategy for disease prevention. Imagine the exhilaration of a well-trained army prepared to defend against impending threats. Vaccines work by introducing a harmless component of a pathogen, such as an inactivated virus or a piece of its genetic material, into the body. This exposure teaches the immune system to recognize and combat the actual pathogen if encountered in the future. The history of vaccination is rich with stories of innovation and perseverance. One of the most notable figures is Louis Pasteur, whose pioneering work laid the foundation for modern immunology. Pasteur's experiments with rabies and anthrax vaccines demonstrated not only the potential of vaccines, but also the profound impact they could have on public health. Imagine the relief and joy in communities as they witnessed the decline of deadly infectious diseases, all thanks to the power of vaccination. His assertion that the germ is nothing, the terrain is everything, underscores the importance of a well-functioning immune system in combating disease. Despite the extraordinary success of vaccines, challenges persist in their development. The emergence of new pathogens, such as novel viruses, can outpace existing vaccine technologies. Moreover, ensuring equitable access to vaccines across diverse populations raises significant ethical and logistical questions. How do we ensure that every individual benefits from these life-saving interventions? Addressing this issue requires collaboration across global health organizations, governments, and communities, uniting efforts to promote widespread vaccination. As we contemplate the future of drug development, particularly in the realm of immune-related diseases, we must acknowledge the hurdles that lie ahead. The complexity of the immune system, with its multitude of interacting components, can lead to unexpected outcomes in drug trials. A medication that shows promise in preclinical studies may falter in human trials due to the intricate dynamics of immune responses. Moreover, the variability of individual immune systems further complicates the landscape. Each person's immune response is shaped by a myriad of factors, including genetic predispositions, environmental influences, and previous exposures to pathogens. This individuality poses a significant challenge in developing universal treatments. How can we tailor therapies to meet the unique immunological needs of each patient? The answer may lie in the burgeoning field of personalized medicine, which strives to customize treatments based on individual characteristics. Precision medicine harnesses the power of advances in genomics and biotechnology, offering a glimpse into a future where therapies are tailored to the specific genetic and immunological profiles of patients. By identifying biomarkers that predict therapeutic responses, researchers can optimize treatment strategies, ensuring that immunomodulators and vaccines are not just effective, but also safe. This approach holds great promise for conditions such as cancer, where the immune response can be harnessed to target tumors effectively. The advent of biotechnological innovations has further transformed the landscape of drug development. Monoclonal antibodies, engineered to target specific immune pathways, represent a significant advancement in this field. These therapies can be finely tuned to either amplify or suppress immune activity, depending on the clinical context. Imagine these antibodies as precision instruments, designed to achieve specific therapeutic goals, capable of navigating the complexities of the immune system with remarkable accuracy. Yet, as we venture into this new era of immunotherapy, we must remain vigilant. The development of these advanced therapies necessitates thorough research and clinical testing to ensure their safety and efficacy. The ethical considerations surrounding their use, especially in vulnerable populations, demand careful attention. It is imperative that we uphold rigorous scientific standards while prioritizing the well-being of patients. In this intricate dance between the immune system and drug action, we find a landscape teeming with potential. The ongoing exploration of immunomodulators, vaccines, and personalized therapies illuminates the path toward more effective treatments for immune-related diseases. As we continue our journey, we are reminded of the profound interconnectedness of science and humanity, where the quest for knowledge drives us forward in our collective pursuit of health and healing. The possibilities are as vast as the universe itself, inviting us to imagine a future where the mysteries of the immune system and drug action are unraveled, paving the way for transformative therapies that enhance our lives. Chapter 8: Personalized Medicine, Tailoring Drug Treatments. Pharmacogenomics is a fascinating field that merges the principles of genetics with the study of drug therapies. It explores how our unique genetic makeup influences our responses to medications, paving the way for a more personalized approach to treatment. Imagine a realm where a doctor can tailor prescriptions not just to the ailment, but to the individual, ensuring that each patient receives the most effective and safest drug regimen. This idea is not merely a dream. It is rapidly becoming a reality, transforming the landscape of modern medicine. At the heart of pharmacogenomics lies the understanding that genetic factors play a pivotal role in determining how we metabolize and respond to medications. Variations in specific genes can lead to differences in drug efficacy and safety. For instance, certain genetic variants can affect enzymes responsible for drug metabolism, altering drug levels in the body. This can lead to situations where a standard dose of a medication may be too strong or too weak for a particular individual. Consider the case of the enzyme CYP6, which is responsible for metabolizing many common drugs. Individuals with certain genetic variants may be classified as poor metabolizers, leading to higher levels of the drug in their system and an increased risk of adverse effects. Conversely, ultra-rapid metabolizers may process the drug too quickly, requiring higher doses to achieve therapeutic effects. As we ponder these genetic influences, one can't help but wonder, how does this knowledge impact our approach to treatment? With advancements in genetic testing, healthcare providers can now assess a patient's genetic profile before prescribing medications. This proactive approach helps to avoid trial and error, reducing the time it takes to find the right medication and dosage. There are numerous case studies illustrating the power of personalized medicine. One notable example is the use of targeted therapies in cancer treatment. Traditional chemotherapy often affects both cancerous and healthy cells, leading to significant side effects. However, personalized medicine allows for treatments tailored to the genetic makeup of a tumor. For instance, in patients with breast cancer, the presence of the HER2 gene can indicate a specific type of cancer that responds well to targeted therapies like trastuzumab. By focusing on the genetic characteristics of the tumor, doctors can provide treatments that are not only more effective, but also minimize harm to healthy cells. Another compelling case is that of warfarin, a commonly prescribed anticoagulant. The effectiveness of warfarin can be influenced by genetic variations affecting the VKORC1 and CYP2C9 genes. Patients with specific variants may require lower doses to achieve the desired anticoagulation effect. Genetic testing prior to initiation of warfarin therapy can help clinicians tailor the dosage, reducing the risk of bleeding events and other complications. As we journey further into the realm of personalized medicine, we encounter the potential for further innovations. Imagine the future where a simple genetic test could guide treatment decisions not only for cancer or anticoagulation, but for a wide array of conditions. This future is not so distant, as researchers are actively exploring ways to integrate pharmacogenomic data into routine clinical practice. The hope is to develop comprehensive databases that can inform healthcare providers about the best treatment options based on a patient's genetic profile. In addition to genetic factors, environmental influences and lifestyle choices also play a role in how we respond to medications. The interplay of genes and environment creates a complex web that researchers are eager to unravel. For instance, diet, age, and even the presence of other medications can impact drug metabolism and efficacy. This holistic view of patient care emphasizes the importance of considering the individual as a whole rather than a set of symptoms. The evolution of technology has opened new doors in this field. Advanced genomic sequencing techniques allow for quicker and more affordable analysis of a patient's genetic information. This progress means that physicians can access valuable insights that can enhance treatment plans. Imagine a healthcare system where every patient's genetics are routinely considered in medication decisions, leading to a significant reduction in adverse drug reactions and improved outcomes. As we reflect on the future of tailored drug therapies, it is essential to acknowledge the ethical considerations that accompany these advancements. With the power of genetic data comes the responsibility to protect patient privacy and ensure that this information is used appropriately. The conversations surrounding informed consent and data security are crucial as we navigate this new frontier of medicine. In the pursuit of personalized medicine, we are reminded of the profound words of a pioneer in genetics who stated that the future of medicine lies in the understanding of our genetic makeup. This future is unfolding before us, offering the promise of treatments that are not only effective, but also attuned to the unique biological symphony that each individual possesses. As we envision the landscape of personalized medicine, it is both humbling and inspiring to consider the potential that lies ahead. The journey toward tailoring drug treatments promises to revolutionize healthcare, making it more precise, efficient, and compassionate. With each step forward, we move closer to a world where medicine is not one-size-fits-all, but a reflection of our individual identities, shaped by the intricate dance of our genetics and biology. As we continue to explore the depths of pharmacogenomics, we come across the intricate relationship between genetic factors and drug response. It is a landscape rich with variation, where even the slightest genetic difference can lead to dramatically different outcomes in treatment. For instance, consider the realm of antidepressants. Selective serotonin reuptake inhibitors, or SSRIs, are commonly prescribed to manage depression and anxiety. However, the effectiveness of these medications can vary significantly from one individual to another. Genetic variations in the serotonin transporter gene can influence how well a patient responds to these drugs. Imagine the frustration of starting a new medication only to find it leaves one feeling unchanged or even worse. This is where pharmacogenomic testing comes into play, guiding clinicians in selecting the most appropriate treatment based on a patient's genetic profile. The promise of personalized medicine extends beyond simply avoiding ineffective treatments. It also aims to enhance the efficacy of therapies. One particularly inspiring example is in the management of cardiovascular diseases. Statins, widely used to lower cholesterol levels, have been shown to be less effective in individuals with certain genetic markers. By identifying these markers, healthcare providers can recommend alternative medications or lifestyle changes tailored to the patient's unique genetic makeup. This proactive approach not only improves patient outcomes, but also empowers individuals to take charge of their health. As we reflect on these advancements, we cannot overlook the contributions of pioneers in the field. One such figure, Dr. Francis Collins, the former director of the National Institutes of Health, has been at the forefront of genomic research. He famously stated, "Genetics is the key to understanding human health." This insight underscores the essence of personalized medicine, where understanding our genetic foundations can lead to more effective treatments. Envision a future where each patient's health record includes a detailed genetic profile. This profile would provide a roadmap for clinicians, allowing for the selection of medication with optimal efficacy and minimal side effects. It is a future where the trial-and-error approach to prescribing becomes a relic of the past, replaced by precision and knowledge. It is not merely a theoretical construct. Rather, it is a growing reality, with healthcare systems beginning to integrate pharmacogenomic data into their practices. However, the journey toward comprehensive personalized medicine is not without challenges. One must consider the ethical implications of such advancements. How do we protect the privacy of individuals whose genetic information may be sensitive? What responsibilities do healthcare providers carry in ensuring that this data is used ethically and transparently? Engaging with these questions is essential as we forge ahead into this new paradigm of healthcare. In addition to the ethical dimensions, we should also consider the technological advancements that are shaping the future of personalized medicine. The advent of next-generation sequencing technology has revolutionized our ability to analyze genetic information quickly and affordably. Imagine a world where genetic testing is as routine as a blood test, paving the way for treatments that are not only personalized, but also proactive. This shift will require an evolution in medical education, preparing healthcare professionals to interpret and utilize genetic data effectively. As we look at the horizon of pharmacogenomics, the future of tailored drug therapies appears bright yet complex. Researchers are actively exploring not only how to apply genetic insights to existing medications, but also how to develop new drugs designed with specific genetic profiles in mind. This innovative approach has the potential to create medications that are far more effective than those currently available, opening doors to new therapeutic avenues. It is also worth noting the significant role of environmental factors and lifestyle choices in shaping our responses to medications. The interaction of our genetics with our environment creates a rich tapestry of influences that can enhance or diminish the effects of drugs. For example, consider the impact of diet on drug metabolism. Certain foods can interact with medications, altering their effectiveness and safety. Grapefruit juice, for instance, is known to inhibit the enzyme CYP3A4, which plays a crucial role in metabolizing many drugs. Imagine the implications of this knowledge for patients who may unknowingly consume grapefruit while on medication, potentially leading to unintended consequences. This holistic perspective is essential in personalized medicine. It emphasizes the need to consider not only the genetic factors, but also the environmental context in which a patient exists. The interplay between genes, lifestyle, and medication fosters a more comprehensive understanding of health and treatment. As we navigate this evolving landscape, we are reminded of the profound interconnectedness of our biology. The complexity of our genetic makeup, combined with the myriad environmental influences, creates a unique profile for each individual. This realization invites us to embrace a more nuanced approach to healthcare, one that recognizes the individuality of each patient and tailors treatments accordingly. Imagine a future where healthcare is not only reactive, but also anticipatory, where the integration of genetic data leads to preemptive strategies in managing health conditions. The concept of personalized medicine holds the promise of not just treating diseases, but preventing them, enhancing the quality of life for countless individuals. As we stand at the threshold of this new era in medicine, the possibilities are as vast as they are exciting. The potential for breakthroughs in tailored drug therapies is immense, with the prospect of creating a healthcare system that is deeply attuned to the unique genetic and environmental tapestry of each patient. The journey toward this vision is not just about the science of medicine. It is about the art of healing, where each person's story is recognized and valued. Chapter 9: Adverse Drug Reactions and Safety Measures. Adverse drug reactions, often referred to as ADRs, represent a complex landscape within the field of pharmacology. These unintended effects can arise from medications and can range from mild discomfort to life-threatening conditions. Imagine a world where the very remedies meant to heal can also cause harm. This duality underscores the importance of understanding ADRs and their implications. ADRs can be broadly classified into two categories: dose-dependent and idiosyncratic reactions. Dose-dependent reactions arise from the pharmacological action of a drug that occurs at therapeutic levels. For example, a common pain reliever, when taken in excess, can lead to gastrointestinal bleeding. In contrast, idiosyncratic reactions are unpredictable and occur in a small percentage of patients, often linked to genetic factors or unique responses to a drug. Picture a situation where someone experiences a severe allergic reaction to a medication, while others taking the same drug feel perfectly fine. This variability can make the landscape of drug safety feel unpredictable. The mechanisms that lead to adverse drug reactions are diverse and complex. They can include drug interactions, where one substance alters the effect of another, and pharmacogenomic factors, where genetic differences influence how individuals metabolize drugs. Imagine the intricate pathways within our bodies reacting differently to the same drug based on our unique genetic makeup. For instance, some may metabolize a medication swiftly, while others process it slowly, leading to differing levels of efficacy and risk. Furthermore, the immune system plays a crucial role in the development of certain ADRs. The body's response to a drug can sometimes trigger an immune reaction, leading to symptoms such as rashes or more severe conditions like Stevens-Johnson syndrome. As Dr. Paul Ehrlich once said, "The right drug for the right patient at the right time." This sentiment rings especially true in the context of ADRs, highlighting the delicate balance between therapeutic benefit and potential harm. Monitoring and reporting adverse drug reactions is an essential strategy for improving patient safety. Healthcare professionals are encouraged to document any unexpected reactions to medications, as this information contributes to a larger database that helps identify trends and improve drug safety profiles. Imagine a vast tapestry of data woven together from countless patient experiences, each thread representing a story of healing or harm. This collective knowledge empowers regulatory agencies to evaluate the safety of medications continually and implement necessary changes. One effective strategy for monitoring ADRs is the use of electronic health records, which can flag potential drug interactions and alert healthcare providers to patients at risk. This proactive approach is akin to having an ever-watchful guardian overseeing the intricate interplay of medications within a patient's system. Additionally, many countries have established spontaneous reporting systems where healthcare professionals can report ADRs, thereby enriching the understanding of drug safety across diverse populations. But who is responsible for ensuring that patients are informed about the risks associated with their medications? Patient education is paramount in preventing adverse drug reactions. When patients are aware of potential side effects, they can recognize symptoms early and seek medical advice promptly. Imagine a patient who has just received a prescription. If they leave the pharmacy armed with knowledge about what to watch for, they are better prepared to navigate their treatment journey. Engaging patients in discussions about their medications fosters a sense of responsibility and partnership in their healthcare. This collaborative approach can enhance adherence to prescribed treatments while empowering individuals to report any unusual symptoms. As health advocate Dr. Adel Gawand expressed, "The secret of good patient care is the patient." Educating patients about the importance of reporting their experiences can lead to a more informed healthcare environment. In addition to individual education, healthcare providers must also be vigilant in assessing patients' medication histories. A thorough understanding of a patient's previous reactions to drugs, allergies, and current medications can help minimize the risk of ADRs. Imagine a healthcare provider, like a skilled detective, piecing together clues from a patient's history to unveil the safest path forward. This meticulous approach can reveal potential pitfalls, guiding the choice of medications that will be both effective and safe. Moreover, the role of healthcare systems in supporting safe medication practices cannot be overstated. Institutions can implement protocols for prescribing, dispensing, and administering medications that prioritize patient safety. For example, using standardized order sets and clinical decision support tools can help reduce the likelihood of errors that lead to adverse drug reactions. Envision a well-oiled machine where each cog represents a step in the medication process, working harmoniously to ensure that patients receive the best care possible. As we reflect on the journey of medications from the laboratory to the patient's bedside, we cannot overlook the importance of vigilance in drug safety. Adverse drug reactions serve as a poignant reminder of the delicate balance between healing and harm. With each new drug that enters the market, there is an opportunity to learn and adapt, refining our approaches to monitoring and prevention. Consider the ongoing advancements in pharmacogenomics as a beacon of hope in this landscape. By understanding the genetic factors that contribute to individual variations in drug responses, we can tailor treatments with greater precision. Picture a future where medications are prescribed not only based on symptoms, but also on an individual's unique genetic profile, significantly reducing the likelihood of adverse reactions. In summary, the intricacies of adverse drug reactions and the safety measures designed to combat them form a crucial part of modern pharmacology. Understanding the types and mechanisms of ADRs empowers both healthcare providers and patients to make informed decisions. Proper monitoring and diligent reporting practices strengthen the safety net for all individuals navigating the world of medications. Education serves as a powerful tool, fostering a collaborative environment where patients become active participants in their healthcare journeys. As we continue to explore the evolving landscape of drug safety, the commitment to understanding and mitigating adverse drug reactions remains vital. The journey is ongoing, and with each new discovery, we take one step closer to a future where the healing power of medications can be harnessed with minimal risk. The process of monitoring and reporting adverse drug reactions is not solely the responsibility of healthcare professionals. Patients play a central role in this intricate system of safety. When individuals actively engage in their healthcare, they create a more dynamic relationship with their providers. Consider the scenario of a patient experiencing an unusual symptom after starting a new medication. If they are educated about the potential side effects, they are more likely to recognize the signs and report them. This proactive behavior can lead to timely interventions, significantly reducing the risk of serious complications. Moreover, the landscape of communication in healthcare is evolving. With the advent of technology, platforms that allow for real-time reporting of ADRs have emerged, creating a more streamlined process for gathering patient experiences. Picture a digital ecosystem where patients can share their experiences, contributing to a collective understanding of drug safety. This data can then be analyzed to identify patterns or trends that may not be evident in clinical trials, where controlled conditions often fail to capture the complexity of real-world scenarios. The importance of patient education extends beyond simply understanding potential side effects. It encompasses a broader awareness of the entire therapeutic journey. Patients should be encouraged to inquire about their medications, asking questions that foster a deeper understanding of their treatment. What are the intended benefits? What should I expect during my course of treatment? This open dialogue ensures that patients feel empowered and informed, enhancing their engagement with healthcare providers. Additionally, the role of community pharmacies as educational hubs cannot be overlooked. Pharmacists are often the most accessible healthcare professionals, standing ready to provide crucial information about medications. Imagine stepping into a pharmacy and encountering a knowledgeable pharmacist who can take the time to explain the nuances of a new prescription. This interaction can be pivotal. It transforms a routine visit into a moment of empowerment, where patients leave with the knowledge they need to navigate their health confidently. Strategies for minimizing adverse drug reactions also extend into the realm of technology. For instance, the implementation of artificial intelligence and machine learning in pharmacovigilance has the potential to revolutionize how we monitor drug safety. These advanced systems can analyze vast amounts of data, identifying subtle signals of ADRs much faster than traditional methods. Envision a future where algorithms sift through millions of patient records in real time, alerting researchers and healthcare providers to emerging safety concerns almost instantaneously. This technological evolution could lead to quicker updates to prescribing information and enhanced safety protocols, ultimately protecting patients more effectively. On a global scale, the significance of standardized reporting systems becomes increasingly apparent. Different countries may have varied approaches to monitoring ADRs, affecting the consistency and reliability of data collected. By fostering international collaboration in pharmacovigilance, we can create a more unified approach to understanding drug safety. Imagine a world where countries share their findings, creating a comprehensive database that enriches our collective knowledge. This collaborative spirit can lead to more robust safety measures and a better understanding of how medications affect diverse populations. The mechanisms by which adverse drug reactions occur can often be traced back to the intricacies of drug metabolism. Our bodies possess an intricate network of enzymes responsible for breaking down and processing medications. Variability in these enzymes can lead to significant differences in how individuals respond to drugs. Consider the CYP450 enzyme family, a group of enzymes pivotal in the metabolism of many medications. Genetic variations in these enzymes can lead to scenarios where a drug may be processed too quickly or too slowly, ultimately influencing its effectiveness and the potential for adverse reactions. The landscape of drug safety is further complicated by polypharmacy, especially in older adults who may be on multiple medications simultaneously. This can lead to increased risks of drug interactions, where the combined effects of medications may produce unexpected outcomes. Imagine an elderly patient managing several chronic conditions, each requiring a different medication. The challenge lies in ensuring that these drugs work in harmony rather than at cross purposes. Thorough medication reviews and coordination among healthcare providers can help mitigate these risks, ensuring a more holistic approach to patient care. In emphasizing the significance of patient education, we must also consider the importance of cultural competence in healthcare. Different cultural backgrounds can influence how patients perceive medications and their side effects. For instance, some individuals may have a heightened sensitivity to certain medications based on their cultural or ethnic background. Understanding these nuances allows healthcare providers to tailor their approach, ensuring that education is not only informative, but also resonates with diverse patient populations. As we delve into the realm of adverse drug reactions, it becomes clear that a multifaceted approach is essential. The integration of patient education, technological advancements, and cultural competence creates a robust framework for improving drug safety. By fostering an environment where patients feel empowered to engage in their healthcare, and where healthcare providers remain vigilant in monitoring and reporting potential reactions, we can move toward a future that prioritizes patient safety. The journey through the landscape of adverse drug reactions reveals an intricate web of interactions between medications and the myriad factors that influence patient outcomes. As we continue to explore this field, the commitment to enhancing drug safety remains paramount. Every step taken toward understanding the mechanisms behind ADRs, coupled with effective monitoring strategies and patient education, paves the way for a more secure healthcare environment. The ongoing dialogue between patients and providers, supported by technological innovations and a shared commitment to safety, will undoubtedly shape the future of pharmacology and patient care. Chapter 10: The Future of Drug Development and Mechanisms. As we look toward the horizon of drug development, we find ourselves on the cusp of revolutionary changes driven by emerging technologies. The realm of drug discovery is undergoing a metamorphosis, with innovations that promise to enhance the speed and efficiency of bringing new therapies to patients. Imagine a future where the painstaking processes that once took years can be accelerated, where the development of life-saving drugs is no longer a lengthy endeavor fraught with uncertainty. This vision is becoming increasingly tangible as we harness the power of advanced tools and methodologies. One of the most transformative forces in this evolution is artificial intelligence. Picture a vast expanse of data, a treasure trove of biological information waiting to be unraveled. Artificial intelligence, with its ability to analyze and interpret complex datasets, serves as a beacon guiding researchers through this intricate landscape. AI algorithms can sift through mountains of scientific literature, clinical trial data, and molecular information at lightning speed, uncovering patterns and insights that might elude even the most experienced scientists. Consider the words of a prominent figure in the field, who once said, "The future of drug discovery lies in the ability to integrate artificial intelligence with human expertise." This synergy of technology and human intuition is paving the way for a new era in pharmacology. Imagine a scenario where AI can predict which compounds are most likely to succeed in clinical trials. By analyzing a compound's chemical structure and comparing it with successful drugs, AI can forecast its potential efficacy and safety. Such capabilities not only streamline the selection of candidates for further development, but also minimize the risk of costly failures. The implications of this are profound, as it allows researchers to focus their energies on the most promising avenues, thereby accelerating the pace of discoveries. In addition to AI, we are witnessing a renaissance in gene therapy and biopharmaceuticals. These approaches offer the tantalizing possibility of addressing the root causes of diseases rather than merely alleviating symptoms. Imagine a world where genetic disorders can be corrected at the molecular level, where a single treatment could potentially cure conditions that have long plagued humanity. Gene therapy involves the introduction, removal, or alteration of genetic material within a patient's cells, empowering the body to heal itself in ways previously thought impossible. The pioneering work of scientists in this field echoes the sentiments of a luminary who remarked, "We are not merely treating diseases, we are redefining the very essence of what it means to be healthy." This perspective encapsulates the ambition behind gene therapy, as it aims to restore normal cellular function, offering hope to patients with conditions such as cystic fibrosis and muscular dystrophy. Biopharmaceuticals, derived from living organisms, are also at the forefront of this transformation. These complex molecules, including monoclonal antibodies and recombinant proteins, have revolutionized the treatment of various diseases, particularly in oncology and autoimmune disorders. Picture a monoclonal antibody as a targeted missile designed to home in on specific antigens associated with cancer cells. By employing this level of precision, biopharmaceuticals can minimize damage to healthy tissues, leading to more effective and less toxic treatment options. Yet, as we venture into this promising future, we must also acknowledge the challenges that lie ahead. The landscape of drug development is riddled with obstacles that can hinder progress. A primary concern is the regulatory environment, which, while essential for ensuring safety, can be a double-edged sword. Striking the right balance between thorough oversight and the need for innovation is crucial. Imagine the regulatory process as a labyrinth where every turn requires careful navigation. Researchers must work closely with regulatory agencies, fostering collaboration to ensure that new therapies can reach patients without unnecessary delays. Furthermore, the costs associated with drug development are a significant hurdle. The journey from laboratory bench to bedside requires substantial investment, and the financial burden can be daunting for many companies, especially smaller biotech firms. This raises an important question. How can we create an ecosystem that fosters innovation while ensuring sustainable funding for promising projects? Equally important is the challenge of accessibility. As therapies become more sophisticated, ensuring that they are available to all who need them becomes paramount. Picture a world where cutting-edge treatments are reserved for the privileged few, while others remain in the shadows of unmet medical needs. Addressing health disparities and ensuring equitable access to novel therapies must be a priority as we move forward. Amidst these challenges, there are vast opportunities waiting to be seized. The future of drug development holds the promise of unprecedented collaboration across disciplines. Scientists, technologists, and healthcare professionals can come together to form interdisciplinary teams, merging their expertise to tackle complex medical problems. Imagine a collaborative network where ideas flow freely, fostering innovation and sparking breakthroughs that could change lives. Moreover, the integration of patient perspectives into the drug development process is gaining traction. Understanding the experiences and needs of patients can guide researchers in designing studies that are not only scientifically rigorous, but also patient-centered. This shift in focus encourages the development of therapies that truly resonate with the individuals they aim to help. As we reflect on the journey of drug development, it is evident that we stand at a pivotal moment in history. The fusion of emerging technologies, artificial intelligence, and biopharmaceutical advancements heralds a new age of possibilities. The challenges we face are formidable, yet they are accompanied by opportunities that can reshape the landscape of medicine. In this unfolding narrative, the vision is clear: a future where drug development is more efficient, equitable, and responsive to the needs of patients. With each step forward, we inch closer to realizing the full potential of pharmacology, unlocking a world of healing that transcends our current understanding. The horizon is bright, illuminated by the hope and promise of what lies ahead. As we ponder the future of drug development, it is essential to recognize the profound potential of emerging technologies that are reshaping the landscape of pharmacology. The integration of computational biology with traditional drug discovery methods is one such advancement, creating new pathways for innovation. Imagine a world where simulations and models can predict how a drug behaves in the human body before it even enters clinical trials. This not only accelerates the discovery process, but also significantly reduces the risk of failure, as researchers can identify promising candidates through virtual screening and predictive analytics. The power of data is further enhanced by the advent of high-throughput screening techniques. These methods allow scientists to test thousands of compounds in a fraction of the time it once took, unveiling potential therapeutic agents with unprecedented speed. Picture a laboratory bustling with activity, where automated systems rapidly assess the interactions between compounds and biological targets, generating data that can lead to groundbreaking discoveries. This automation does not replace human intuition. Rather, it complements it by providing a wealth of information that researchers can analyze and interpret. artificial intelligence is also playing a pivotal role in drug repurposing, an innovative approach that seeks to find new uses for existing medications. By leveraging AI algorithms, researchers can sift through vast databases of clinical data, identifying novel applications for drugs that may have been overlooked. Imagine a scenario where a medication developed for one condition suddenly reveals efficacy in treating another, entirely different disease. This not only saves time and resources, but also provides patients with new treatment options that may be more readily available than newly developed therapies. As we delve deeper into the realm of gene therapy, the landscape continues to expand with the development of CRISPR technology, a revolutionary tool that allows for precise editing of genetic material. This powerful technique has the potential to correct genetic defects at their source, offering hope for conditions that have long been deemed incurable. For instance, consider the prospect of using CRISPR to target and edit the faulty gene responsible for sickle cell disease, a condition that affects millions worldwide. With such advancements, the notion of curing genetic disorders is no longer a distant dream, but a tangible possibility. The implications of these technologies stretch far beyond individual therapies. They herald a new era of personalized medicine, where treatments can be tailored to the unique genetic makeup of each patient. Imagine receiving a prescription that has been specifically designed to work with your body's unique biology, minimizing side effects and maximizing effectiveness. This shift towards individualized care is supported by the growing field of pharmacogenomics, where understanding genetic variations can inform treatment decisions, ensuring that every patient receives the most appropriate therapy for their specific needs. However, as we embrace these opportunities, we must remain vigilant about the challenges that accompany rapid technological advancements. The ethical considerations of gene editing and the potential societal implications of such powerful tools cannot be overlooked. For instance, as we venture into the realm of gene therapy, we must ask ourselves, who has access to these life-altering treatments? The potential for inequities to arise is a pressing concern, especially if access to cutting-edge therapies remains limited to affluent populations. Moreover, the regulatory landscape must evolve to keep pace with these innovations. As new therapies emerge, regulatory frameworks will need to adapt to ensure that they are both safe and effective, while fostering an environment conducive to innovation. Balancing patient safety with the need for timely access to new therapies is a delicate task, one that requires collaboration between researchers, regulatory agencies, and the pharmaceutical industry. Imagine a future where these stakeholders work in harmony, streamlining the approval process without compromising safety, allowing patients to benefit from breakthroughs more rapidly. The financial aspect of drug development also presents formidable challenges. The considerable costs associated with bringing a new drug to market can be a significant barrier, particularly for smaller biotech firms that may lack the resources of larger corporations. This raises a vital question. How can we cultivate an ecosystem that supports innovation while ensuring that promising therapies can be developed and brought to patients in a sustainable manner? Public-private partnerships and innovative funding models may provide some answers. By pooling resources and expertise, stakeholders can share the financial burden of drug development, enabling a more collaborative approach. Imagine a consortium of academic institutions, biotech companies, and government agencies working together to tackle complex health challenges, each contributing their unique strengths to achieve common goals. Such collaborations could foster a more vibrant and resilient landscape for drug discovery, ultimately benefiting patients worldwide. In parallel to these developments, the emphasis on patient engagement is gaining traction. The shift towards patient-centered drug development recognizes that those who will ultimately use these therapies should have a voice in the process. Imagine a scenario where patient feedback shapes the design of clinical trials, ensuring that they address real-world concerns and priorities. This approach not only fosters trust, but also empowers patients, making them active participants in their own healthcare journeys. As we explore the future of drug development, the confluence of technology, collaboration, and patient empowerment is poised to redefine the pharmacological landscape. Each advancement brings us closer to a reality where therapies are not only more effective, but also more accessible. The horizon is bright with possibilities, illuminated by the collective efforts of scientists, clinicians, and patients working together to unlock new frontiers in medicine. The journey ahead is filled with both challenges and opportunities, each step forward promising to enhance our understanding of health and disease. In this ever-evolving narrative, the potential for discovery and innovation is boundless, inviting us to envision a future where the benefits of drug development touch every corner of society.